Valsartan is a medication used to treat high blood pressure, heart failure, and diabetic kidney disease. It is a reasonable initial treatment for high blood pressure. It is taken by mouth. Versions are available as the combination Valsartan, hydrochlorothiazide, Valsartan, amlodipine, Valsartan, amlodipine, hydrochlorothiazide, or Valsartan, sacubitril. Common side effects include feeling tired, dizziness, high blood potassium, diarrhea, and joint pain. Other serious side effects may include kidney problems, low blood pressure, and angioedema. Use in pregnancy may harm the baby, and use when breastfeeding is not recommended. It is an angiotensin II receptor antagonist and works by blocking the effects of angiotensin II. Valsartan was patented in 1990, and came into medical use in 1996. It is available as a generic medication. Medical uses. Valsartan is used to treat high blood pressure, heart failure, and to reduce death for people with left ventricular dysfunction after having a heart attack. High blood pressure. It is a reasonable initial treatment for high blood pressure as are ACE inhibitors, calcium channel blockers, and thiazide diuretics. Heart failure. There is contradictory evidence with regard to treating people with heart failure with a combination of an angiotensin receptor blocker like Valsartan and an angiotensin-converting enzyme inhibitor, with 2 major clinical trials showing a reduction in death, and 2 others showing no benefits, and more adverse effects including heart attacks, hypotension, and renal dysfunction. Diabetic kidney disease. In people with type 2 diabetes and high blood pressure or albumin in the urine, Valsartan is used to slow the worsening and the development of end-stage kidney disease. Side effects. Rates of side effects depends on the reason the medication is used. Heart failure. Rates of adverse effects are based on a comparison versus placebo in people with heart failure. Most common side effects include dizziness, 17% versus 9%, low blood pressure, 7% versus 2%, and diarrhea, 5% versus 4%. Less common side effects include joint pain, fatigue, and back pain, all 3% versus 2%. Hypertension. Clinical trials for Valsartan treatment for hypertension versus placebo demonstrate side effects like viral infection, 3% versus 2%, fatigue, 2% versus 1%, and abdominal pain, 2% versus 1%. Minor side effects that occurred at greater than 1% but were similar to rates from the placebo group include headache, dizziness, upper respiratory infection, cough, diarrhea, rhinitis, sinusitis, nausea, pharyngitis, edema, arthralgia, food interaction. With the tablet, food decreases the Valsartan tablet taker's exposure to Valsartan by about 40% and peak plasma concentration by about 50%, evidenced by a UC change. On the 6th of July 2018, the European Medicines Agency, EMA, recalled certain batches of Valsartan and Valsartan, hydrochlorothiazide film-coated tablets distributed in 22 countries in Europe plus Canada. In people with impaired glucose tolerance, Valsartan may decrease the incidence of developing diabetes mellitus type 2. However, the absolute risk reduction is small, less than 1% per year, and diet, exercise or other drugs may be more protective. In the same study, no reduction in the rate of cardiovascular events, including death, was shown. In one study of people without diabetes, Valsartan reduced the risk of developing diabetes mellitus over amlodipine, mainly for those with hypertension. A prospective study demonstrated a reduction in the incidence and progression of Alzheimer's disease and dementia.